So sitting upright at the more towards the front of the chair, and you're just coming up on the toes, then the heels, and you're deliberately using the muscles. So you're pulling up quite hard with the feet, so use this muscle here. Then you're rolling your foot onto the ball of the foot, feeling the calf muscles work, rolling back, pulling the feet up. You can lean forward to get more weight, so more pressure. And these exercises are really well done standing up, by the way, too. And even on one leg as well, for progress. And from here we're going all the way up to the tippy toes. So I'm pushing through my big toe. So through the ball of the foot, then I push with the big toe down, all the way up to the tip of the toe. Rolling that carefully back down, pulling up into the ball of the foot, push through the big toe, strengthening the flexor hallucis longus muscle, which can one of the muscles that controls rotation, pronation, supination of your feet. Then from here, keeping your knees still. So your knees don't move at all. They'll want to move. It's because the body's trying to figure out how to control rotation in the knee. And all we're doing, picking the feet up and we're pivoting like this. So this is movements coming from my knee. So from the tibia, the shin bones. So I'm just turning out as far as I can. People usually do this quite easy, but it's usually a difficulty turning the feet inwards. And you may find there's one foot that goes a bit more in than the other. And it's usually the right one doesn't want to come in as much and turning out. So most people have tibias that are externally rotated. That affects how the foot moves. It affects the internal rotation of the hip. And most hips need more internal rotation. So we're just getting good at feeling that movement coming from here. So you're focusing on this area in the knee. You just keep trying to turn your feet in more and more without your knees doing this. So we're just isolating. My knees are staying totally still here. There. Then popping your right ankle up onto your knee. And you're just sitting forward and letting your body slump. So usually this is taught, you kick your back really straight. It's fine, it's good. We're doing something a little bit different here. So we're letting the back round. And all I'm doing here, I'm breathing in through the nose. And I'm breathing, letting my back inflate. And a sense of also inflating my pelvis. So we're using the breath. Then out through the mouth. In through the nose. Inflate the back, inflate the pelvis. You may find your body just wants to drop down more as you breathe out. Then sit up straight, pull that knee towards opposite shoulder. So we're getting more space in the hip capsule and stretching the piriformis muscle, stretching all the glute muscles, and we're stretching open the muscles and the fascia in the back. And helping the kidneys to move too. So the kidneys, when we breathe, they move out and down about 1 to 3 centimeters. So in this motion, it's actually part of kidney breathing in Qigong. So it's helping the kidneys to move, which opens all the fascia in your back. Then we come forward again, and I'll just show you this from the side. So I'm letting my back round here. So I'm not staying straight. You may feel you're trying to round, but the back's staying straight, that's fine. Just shows how much of an extension pattern your body's in. It'll feel like you just got really tight glutes, but it's actually an extension pattern in the spine. So we're letting that round out, and we're breathing in through the nose as if I'm inflating my back and the pelvis, and I breathe out. Then I start rocking this knee here, the leg with the foot on the ground. I just rock the knee side to side, and that'll open and close the SIJ, exactly that joint at the back of my pelvis, and stretch the muscle in the capsule a bit more. And what that looks like from the side is just that. So it's this knee making the motion. This one's quite passive. And we change sides, same thing again. And you'll find one side's tighter than the other. Often it's the left side. Just letting my back round out, getting a stretch in my glute, breathing in through the nose, inflating the back, inflating the pelvis. Not trying to force it, just letting the weight of my body do all the work and the breathing. And if this causes pain in your knee, you pull your foot up like that. That can help stabilize it, or you can keep the foot a little bit turned this way. So I'm trying to turn the foot up this way. It'll cause an internal rotation in the knee that often helps a lot of knee issues if you feel pain here. If that doesn't help, don't do this position, get into your knees better. Then from here, sit up straight, bring that knee to the shoulder. I'll stretch the glute differently. And we just breathe into the pelvis again. It sounds like a silly idea to breathe into your pelvis, but your pelvis does actually expand with every single breath we do. And from here, we do the same thing. So we're crunching forward again, or slumping forward is the word. About 5 breaths is good. And we're moving the knee, so this leg, moving the knee, rocking like you're rocking your baby. Okay, so that series will expand open the hip joints and allow more play in the hip joints. It'll take pressure out of your back, pressure out of your knees. It'll help the movement of the feet too. And repeat that sequence again too. So we're coming back up to here and repeating that series. Back to here, bend over forward again, do the 5 breaths. Then we're just rocking this side to side and we change legs.